Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a Hilaal exclusive. I'm Luqman Shadrack. It is such a privilege to be here in Johannesburg today, where we are covering and continuing with a story that has evolved and has touched the hearts of so many of us. We've had the community, we've had the medical profession get involved in assisting with youngsters that have been affected in Palestine and have arrived in Johannesburg a couple of weeks ago and have now gone through rigorous treatment, and alhamdulillah, they are doing so much better. Now, to give you a backstory and to paint a picture of how this all came together, I'm joined by one of the doctors that was very instrumental in allowing this procedure and being part of this initiative as well. I'd like to welcome Dr. Mita. Assalamu alaikum.
Wa alaikum salam. How are you?
Alhamdulillah. Jazakallah for giving me and affording me your time.
Fantastic. Alhamdulillah. It's indeed the day of Jumu'ah. It's a big day. It's a very blessed day. And alhamdulillah, on this Mubarak day of Jumu'ah, we have in Pretoria the Imam of the Al-Haram in Makkah, who will be performing Jumu'ah in Pretoria. And also on this Mubarak day, we have our little kids from Gaza, Mira and Lina, who have been discharged home. And alhamdulillah, you know what, they arrived on South African soil almost 2 weeks ago, and having sustained injuries in the war, or should I say during the genocide. We had Mira, who had burns and a fracture to a lower limb, and had difficulty in walking. She had an osteomyelitis, or an infection in the bone, which we treated. She's been receiving physiotherapy. There are certain grafting and plastic surgery that's still required, but at this point, the specialist team that have assisted think that, you know what, we can't wait. She's only 9 years old. So we're going to continue her rigorous physiotherapy and rehabilitation at home. So she'll probably be here for a few more weeks, but obviously receiving outpatient treatment. Lina arrived 2 weeks ago, Wednesday, and this is a young girl who had what we call a osteonecrosis of the hip joint, which is literally bone death. Obviously, Dr. Nabil will speak a bit later and he'll elaborate further. He's the orthopedic surgeon. And so she came in having not walked. Also an explosion injury, and over the last 9 months has been waiting surgery. So fortunately, you know, the thing is, her name came up, her record came up and was passed on to the medical team from PCRF, which is the Palestinian Children's Relief Fund. We assessed her case and said, okay, fine, you know what, at Raslouw Private Hospital, we will be able to treat her. And effectively, she came in the previous Wednesday, had a surgery on Saturday, and alhamdulillah, thumma alhamdulillah, she is walking. So she's going to be making her way from the ward, and I'd like that to be obviously a story that is covered. It is incorporating the Gift of Mobility program, which Meal SA has initiated. So obviously this program was initiated by Meal SA. I'm one of the founding members of Meal SA, and a program which we coordinated in conjunction with the Raslouw Private Hospital, also one of the directors there. So it was an easy sort of relationship to arrange. And alhamdulillah, today we have this fortunate should I say, circumstance where we have children from Gaza who've been afflicted by the war, who've had severe explosive injuries, walking out of our hospital today. Inshallah, you will see that camera footage. I've got Dr. Nabil with me, but obviously what I'd like to do is also, you can never ever be thankful enough to our Creator for affording us the opportunity, and obviously to the people that have been involved, Meal SA for facilitating, PCRF for being our partners on the ground in Gaza, and obviously Raslouw Private Hospital and our medical team. Thank you very, very much. The community of Lodium who've taken care of Lodium, Erasmia, Raslouw, Eldo Glen. This entire precinct has come together and really, really shown a phenomenal amount of strength in support. So I'd just like to congratulate everyone and thank everyone from the bottom of my heart. Alhamdulillah, and obviously to our Creator. Alhamdulillah, thumma alhamdulillah.
Dr. Jazakallah for all your efforts that you've put in, and may all your future projects go from strength to strength, inshallah. But at the same time, a project like this paves the way for South Africans' involvement in seeing to other patients from Palestine and some other parts of the world as well. Will there be future patients coming through and being assisted in the same way?
So alhamdulillah, you know, the thing is, obviously now with us having sort of cut our teeth and found a little bit of a footing in terms of how to treat these patients and navigate the difficult terrain, you know, in terms of getting them here. So alhamdulillah, you know what, I think we will, in collaboration with PCRF, put up our hands and say, listen, we are in a position to treat more children. And this is called the Gift of Mobility program, and we are going to be looking at bringing more amputees. There are a few patients that they've discussed with me over this last week, and inshallah over the next maybe week or two. You know, obviously it's very difficult. I can't really give an estimation in terms of time, right? I mean, we've worked close on to 8 months to bring these 3 children here. So I'm hoping that the process will be a lot easier. And inshallah, over the next 2 weeks, we've got 2 kids. One is an amputee who's going to need an artificial limb, and the other is a severe burns patient. And remember, I mean, just to quickly go back, we had 3 cases. Mira, our first case, explosive injury, traumatic fractures to the lower leg. We had Lina, who had the osteonecrosis of the hip, also explosion injury. And then the real tragic case is the one with our baby Synod, who's got the phosphorus burns. You know, and I mean, that child really, you know, got us crying the minute we saw the kid. And I mean, knowing what he's been through. You know, I've been describing it on various social media platforms as someone sitting with a lighter and a torch on the inside of your body and lighting it whenever they wanted to. Because that child has new burns every single day, 10 months post-exposure to the chemical white phosphorus. So he's got extensive surgery that's coming, multiple surgical procedures that we are going to be required to do. We were in a very fortunate position to have Mufti Menk visit our 3 children on Sunday, and on that particular day we also had 5 kids assess baby Synod. 5 super specialists who assessed his condition. And what we've realized is that he's got extensive internal burns, not just external. So whatever we're seeing, the blistering and this big water bully, is happening on the inside of the body as well. So his entire throat, the larynx and the esophagus, so eating is a problem, he's aspirating, he's developing pneumonia, his kidneys have been affected because of urethral obstruction. But I mean, those are things we can discuss, but Synod hasn't been discharged. Obviously, I think we got a long way to go with baby Synod. He's only 2 years old. Phosphorus burns, I mean, it's atrocious what has happened to him. So inshallah, we make dua that Allah grant him shifa, and we make dua that all these kids who you are going to be videoing shortly are going to be, inshallah, carrying the legacy of Gaza, having been rehabilitated, and all we're going to do is obviously continue that rehabilitation process, inshallah.
Dr. Jazakallah so much for your time, for all your efforts, and may Allah bless you and continue to guide you onto the right path with regards to ensuring that these kids heal extensively accordingly, inshallah.
Jazakallah khair. Assalamu alaikum wa rahmatullah.
Salam. That's Dr. Mita, who's been, you can't help but have a lump in your throat when Doc describes what these kids go through. We can't understand, and how beautiful that the community has come together to ensure that these beautiful kids have now received the proper treatment. For Hilaal Exclusive, I'm Luqman Shadrack. Assalamu alaikum. We continue with the conversation with regards to the 2 children that have been released from hospital, and one of the other orthopedic surgeons involved and very instrumental is Dr. Nabil. Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Jazakallah so much for affording me your time. It's such an honor being here, and Allah has guided your hands, your wisdom, your expertise to ensure that these 2 young beautiful children can now be able to walk as well. Talk to us about your involvement from the time they arrived and to where they are now.
Okay. It's now 2 weeks that the 2 girls who were injured in the war in Gaza that arrived. Mira is the 9-year-old girl who came in with a complex left lower leg fracture. When she came in, we did some investigations and we found that the leg had healed, but with some infection. She obviously didn't get the appropriate rehabilitation in Gaza and in Egypt, where they were for a while. And here in South Africa, we started an intense rehabilitation program. We started them on IV antibiotics, and 2 weeks later, the infection has cleared. She's also gained confidence in walking. She came in with a wheelchair, and today you will see that she is walking and feeling more confident about it.
We're calling this the Gift of Mobility project. I mean, it's apt in terms of what you guys have done here, but more importantly, the engagement that's come through from community and the medical staff as well. You must be so honored to be part of a project like this.
Look, it's a first for South Africa. As you know, the stance of the South Africans with the war in Gaza, we really thank all those involved. It wouldn't be possible, obviously, with the community, firstly, and also the community that showed the family a lot of warmth and support in the hospital. The Raslouw Private Hospital staff welcomed them. There were obviously massive language barriers between, and we navigated our way around this. As South Africans, you know, we are used to difficult times and we know how to navigate through these things. And it was actually a blessing. I think in hindsight, when you look at the staff and you see them, they're all really happy, they're showing the smiles. It shows that when they came in, we felt a bit despondent. 2 girls, I mean, the other girl was Lena, 17-year-old girl, who also had a bad fracture. But today she's walking out of the hospital. So this just shows that with the appropriate help, obviously with the Almighty guiding us through all of this, and with the support from the community, with the funding from the PCRF and Meal SA, and obviously without the community, that's not possible. So we are truly grateful. It was probably the start of a beautiful experience for all of us, and hopefully we can help a lot more patients.
Dr. Nabil, Jazakallah for your time again. Once again, we will catch up with you in the future. It looks like the project is not done just yet. Inshallah, we can assist more kids coming from Palestine, but may Allah bless and guide you, inshallah.
Thank you so much. Okay, assalamu alaikum.
That's Dr. Nabil, who has been so instrumental in providing the assistance and being part of the orthopedic for these 2 young kids. For Hilaal TV, I'm Luqman Shadrack. We're still at the hospital where the 2 beautiful children from Palestine have just been released from hospital, and we now chat to one of the children, and Lena, and we have an interpreter just to interpret my questions as well. Assalamu alaikum, Lena.
Alaikum assalam.
Jazakallah so much for coming through and talking to us. Can you tell me about, from the time you arrived in South Africa and the treatment that the doctors took you through?
ممكن تشرحي له بصورة مختصرة من الوقت اللي وصلتي فيه جنوب إفريقيا وإيش العلاجات أو اللي استلمتيها في المستشفى أو إيش اللي تعرضتي له، يعني إيش البروسيجر اللي عملوا معاكي؟
وصلنا قبل أسبوع والحمد لله أبدوا الإجراءات بسرعة وعملوا لي العملية وتعالجت الحمد لله، وبشكركم على استضافتكم وعلى العلاج. وكنت أخذ علاج للعضلات عشان يقوى بس.
وهلا تاخذيها؟
للحل.
She said we just arrived like 1 week ago, and the minute that we arrived to South Africa, they started immediately with the blood test and then the x-rays, and they decided for the operation. The operation was done so quickly, alhamdulillah, and everything is fine, and she's improving by the time. And she wants to also to thank everybody who was involved in her treatment. The whole staff were so friendly as well, and she's still on medication, but she's getting better and better, alhamdulillah.
So can we expect you to take part in the next Olympics or the next sporting event?
بقول لك هل بتتوقعي انه ممكن يعني بعد هيك ان شاء الله تشاركي في الاولمبيات مثلا او اي مسابقه رياضيه؟ يعني حاسه حالك ان شاء الله حتتحسني وممكن تشاركي؟
أكيد.
Inshallah.
Yeah, she said inshallah, certainly she will do that. At least she has a very positive attitude. Yeah, alhamdulillah. Yeah.
South Africa has been very instrumental in providing assistance to Gaza. Is there any special message that you would like to give to the community in South Africa of our link and our du'as that get sent to Gaza?
بقول لك طبعا جنوب افريقيا دوله داعمه جدا لفلسطين ولغزه بالذات لاهل غزه، فهل في عندك رساله حابه توجهيها للمجتمع الجنوب افريقي هنا لانه هم دائما بيدعوا ومرتبطين جدا بالشعب الفلسطيني، فايش الرساله اللي حابه توجهيها للشعب الجنوب افريقي؟
شكرا كثير لكم لتضامنكم معنا والحمد لله إنه أنتم بتدعمونا ومعنا واقفين.
She said, I would like to thank everybody in South Africa, all the South African community for their support and unwavering support for the Palestinian people. And alhamdulillah that there is some people that feel our struggle and they keep praying and supporting us.
Shukran so much. And there we go. That's one of the children being released from hospital, Lena, who's gone through the treatment and on the road to recovery. We now speak to one of the other beautiful children that's just been released from hospital, little Mira, who's just an amazing soul as well. Assalamu alaikum, Mira.
Alaikum salam.
Shukr so much for talking to me. And can we ask Mira, from the time she arrived in South Africa, what has the treatment been like, and can she describe what she went through?
اوكي ميرا حبيبتي، بيسالوكي من اليوم اللي وصلتي فيه جنوب افريقيا ايش العلاج الطبي اللي اخذتيه في المستشفى من ساعه ما وصلتي؟ ايش عملوا لك في المستشفى؟
عملوا لي فحص دم وفحصوني عشان يشوفوا في عندي التهاب ولا لا، وطلع هذا، وبعديها احنا رحنا على السكن ورجعنا على المستشفى وطلع في التهاب وقعدنا اسبوعين هنا بالمستشفى اخذ العلاج عشان هذا اخذ العلاج في الوريد عشان هذا يروح الالتهاب.
Okay, she said since she arrived, also she received an immediate treatment. They did a blood analysis, X-ray, CT scan for her, and checked if there is infection in the bone. And after that, when they discovered like there is a little bit of infection, she were admitted and she were on IV antibiotic for a while until she's getting better now. Alhamdulillah.
How do you feel now, Mira, now that you have gone through the treatment and now that you can walk, you can jump, you can skip? How do you feel?
بقول لك كيف هلا بتشعري بعد ما انت اخذتي العلاجات؟ هلا بتقدري تمشي، بتقدري تنطي، بتقدري تلعبي، كيف انت بتشعري هلا؟
أنا حابة أشكر جنوب أفريقيا عشانهم خلوني أعرف أمشي وألعب وأعمل كل إشي.
Okay. She said, I would like to thank South Africa for the treatment that I received because now I can skip, I can play, I can like return to my daily life as a child. Alhamdulillah.
Shukran so much, Mira. All the best to you, and we will try and speak to you again.
Okay, thank you very much. بقول لك شكرا كثير يا ميرا. بنتمنى لك السلامة وإن شاء الله حنرجع نحكي معك مرة ثانية.
إن شاء الله.
إن شاء الله. Thank you. Thank you.
And there we go. That's little Mira, who, as you can see, is able to walk with the assistance of the doctors right here at the hospital. For Hilaal TV, I'm Luqman Shadrack. Assalamu alaikum. Welcome back to Hilaal Exclusive. Now, I have the privilege of chatting to the staff at the hospital that was so instrumental, so patient, so diligent in allowing these two young ladies to go through their treatment. First up, I'd like to speak to Marike, who is the hospital manager. Good morning, and how are you?
Well, thank you.
Thanks for taking the time. Now, I chatted to the two girls, I chatted to the doctors, but let's face it, you guys are the most important people here in this project. Tell us a bit more about your involvement with the treatment of these two little girls.
So I think from Raslow's side it's been an absolute privilege to be part of such a project. We have become very attached to the patients. In terms of the way of communication with them, that's been a struggle in the beginning. We have adapted to apps that we've created, and that we've taught them a few English words. Myself taught them a few Afrikaans words and how we communicating with them. But I think it's been an absolute privilege for us to see the remarkable change that we could have done in these patients' lives.
It's such an honor to be in your presence as well. And also, I would imagine the patience that takes, the administration and the staff to be involved in a project like this. Lisa, as part of the nursing, you guys must have been 24/7 in charge of looking after these two little girls. What was that like?
Okay, so I do think, especially the aftercare for these two girls and Leah that had the hip replacement, it is important. Dr. Nabil did the big operation, and it was a huge success, but the aftercare is very important. So aftercare was in high care for the first 48 hours, where she gets specialized care by the nursing staff, and after that the physiotherapist and the mobilization and everything like that. So it was a huge privilege for us to be part of it. We saw the way she came into the hospital and what the big difference between the two legs was, and how difficult it was for her to move around, even with crutches. So it's very nice to see that she can walk up straight, and so it is a big privilege for us to be part of it.
Was there a learning curve and process through this project? Did this elevate your staff in how they handle other patients going forward?
No, I don't really think so. We do get local patients with the same conditions in as well, so that's also getting assisted. Normal day for us, yes. Yes.
Thank you so much for being part of this project, for your patience and for your willingness as well.
It's a pleasure. Thank you so much.
Mariki, I know that you had an outing with these two young ladies. Tell us about that.
So it was with Mira. So I think for her age, I have a daughter the same age. I could see where she was getting bored. You can only entertain them as much with the television. So I think from the community side, we have seen tremendous help and assistance. We have some teachers coming to give some books. She actually told them that she wants more harder work. So that was quite nice, and to see how the community also comes together to actually assist with all the needs of the patients. So that was quite thrilling for me to see. The Butterfly Foundation ladies as well, how they also came on board and assisted us. But I decided to take them with my family to the Lion Park for an outing, and I think my kids realized that what we take as a privilege to see a lion every day, because we can go every weekend, but to see their faces, not just Mira, but the patients, it was priceless. And I think it was good for her. I think it boosted morale. And if we could do that for all the patients, it would be great. But we did a nice day pass for her, and I think it did very well for the morale.
What does this mean for the hospital going forward? What does this mean for the project going forward as well, and for everybody? That was just amazing in all of this.
No, I think it's everybody that came together, because there's quite a few role players that made this possible. I think we're looking forward to more patients that we can assist. We're definitely going to be more prepared in terms of the language barrier and everything that we found a bit difficult the first round, but we got a way around it. And we get attached to these patients, and that's the other thing as well. But I think that's all patients coming into this hospital that needs that just little bit of extra TLC. So we as a hospital, we're geared, we're ready, and we're reaching out to everybody to say, get involved and see how you can assist us in making this difference.
And to everybody that was involved, that came together to ensure that everything ran smoothly as well, any special message to them?
I think specifically to Gaza from PCRF, Meal SA, who made it all possible as well, and then the Butterfly Foundation. Those are the three that I'd really like to, and then obviously our specialists, because these guys come in their own personal time to assist. I think to say to them, the physios, everybody involved, that takes time out of their personal time to assist with these patients. A huge thank you to all of them.
Thank you, ladies, so much. Have a great afternoon. Thank you. There we go. The administration and nursing staff making sure that the project ran smoothly. Such an honor and privilege to be in the company of people like this. For Hilaal TV, I'm Lukman Shadrack. I now have the privilege of chatting to the CEO of the Raslouw Hospital right here this afternoon. Dr. Ibrahim, assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Jazakallah for taking the time to chat to me as well. It's such an honor to see these two young ladies in the progression since they arrived at the hospital and to where they are now, the smiles and the confidence that has come out of the treatment as well. What does this mean for the hospital to be involved in a project like this?
Okay. So for Raslouw Private Hospital, it's been an honor and a privilege to help these two children that have been discharged today. We've had some amazing results. They both came in on wheelchairs and they're both going walking. So it's a huge success for the mobility program that was initially started. And I think it forebodes well for the future, and hopefully we can get more of these Gaza children in and inshallah help them to get mobile again. I think that's our primary goal, is mobility here. And we've certainly shown it with Lena with a hip replacement, which was really completely destroyed. She had a total hip replacement with a huge success. And we've got her walking, so I'm really very happy. Thank you to the doctors, thank you to MILESE, thank you to the Palestinian Children's Relief Organization, and to everyone else who supported us.
I think the big winner here is definitely the confidence that is given back to children that have gone through what they've gone through, and no children should ever go through that. Unfortunately, it was a time where the hospital came into play and ensured that it gives them back the confidence, gives them back a great part of their life that they can go on. Are we looking to do more projects going forward? Is this a basis where you can now expand on?
Yes. So our aim, and we've asked the PCRF to send us more patients. We've requested especially amputees who need prosthesis, anyone else with hip or bone problems which we can easily treat. So any condition there where we can get these children mobile again, it's vital, and we can certainly assist in that way. As you know, there's over, I think, 10 or 20,000 children amputees in Gaza at the moment, and it's increasing at a daily rate. They haven't stopped. The killing hasn't stopped. It's almost 1,000 people killed every month, but we're forgetting about those who've been wounded. And the use of these high explosive devices, literally, it causes instant amputation. We all see it on Instagram and in the news every day. There's kids who are amputees with absolutely no help in Gaza. All the health facilities destroyed. So the burden is huge, and we'd like to make a difference. And even if it's a small difference, so we get one child walking, what I said initially, we've won. We've got 2 children walking. We've definitely won, but we want to keep winning. And we want to keep assisting these children who are in need.
Jazakallah, Doctor, for all your efforts, for putting the program together, for ensuring that everything runs smoothly. And like we said, the big winners are these 2 beautiful children that can now live a much better life as well. Any last words to the staff and, especially to the parents of these young ladies as well?
So firstly, I'd like to thank my staff. They were really dedicated. A lot of our staff didn't even know about the Palestinian issue, and they've gone and researched it. On their own, they've actually put things together like getting clothes for the parents of the kids, MILESE for organizing literally everything. The Palestinian Children's Relief Organization have done a fantastic job, and they keep on doing a fantastic job. To all the listeners out there, if you need to donate, please donate to MILESE. We've got a lot more children. As you know, we've got a younger 2-year-old who's going to need extensive work to his trachea because of the phosphorus burns. And that's going to be a long story, not a quick fix like we had with these 2 children. So I'm sure they will need funds for that, and for the many other children that inshallah will be coming.
Dr. Ibrahim, Jazakallah, once again, have a great afternoon. Assalamu alaikum. That was Dr. Ibrahim, who's the CEO of Raslouw Hospital, and such a privilege and honor. And we want to say shukr to everybody involved. For Hilaal TV, I'm Luqman Shadrack.